I want you to think back to your breakfast this morning. Do you remember how many carbohydrates were in your meal, or how many grams of sugar were in your morning coffee? For most of us, we don't think about these numbers on a day-to-day basis. But for people with type 1 diabetes, their entire life is made up of numbers. What's their blood sugar right now? How did it do over the past 3 months? Was it too high or was it in range? How much insulin do they need to have a piece of cake at a birthday party? And yet, for a disease that is so focused on numbers, there are a couple numbers that often go overlooked. For example, people with type 1 diabetes are twice as likely to break their bones and have a 6 times higher risk of hip fracture in older adulthood. Here's another number for you. People with type 1 diabetes are twice as likely to develop osteoporosis. Now, here's another really important set of numbers, is when we look at this figure here, we can see the only years in our life where we can build up our bone strength is during childhood and adolescence. You now see this nice blue highlighted line there. That shows the years when type 1 diabetes is typically diagnosed, and we can see it's the same as those bone building years. So this leads us to hypothesize, well, maybe there's something about type 1 diabetes during childhood that's leading to these bone impairments. That's where my thesis comes in. I want us to circle back to some of those all-important diabetes numbers, like how much sugar is in your blood, how long you've had diabetes, to understand if that's contributing to altered bone parameters. In order to assess this, for my thesis, we're having children and adolescents with type 1 diabetes come into the McCaig imaging lab, where we're doing high-resolution 3D imaging of the wrist and shin bones to look at how much bone these kids have with type 1 diabetes, how it's shaped, and how strong their bone is. Then we're looking to their medical records to see, well, how was their blood sugar over the past couple of months, and when were they diagnosed? I'll then be able to say, okay, is there anything about these diabetes parameters that's looking to decrease their bone density? So far, our preliminary results are showing that if you're diagnosed with diabetes closer to puberty, you might be more likely to have poorer bone density in your shin. Overall, better understanding who with type 1 diabetes is most at risk for poorer bone outcomes will help us understand who needs to be screened and who might benefit from bone health promotion exercises or implementations, so that we can decrease the amount of fractures and osteoporosis that's being diagnosed, and ultimately give people with type 1 diabetes a couple less numbers to worry about. Thank you. Oh, questions? Questions?
Do we have any questions for Jada?
Go ahead. Yeah, so this study is a part of a 4-year prospective cohort study. Based on the timeline for my thesis, I will only be looking when these kids are about 10 to 12 years old for their first visit, but the overall study will be comparing kids across the years kind of leading up to their growth spurt and the years following. That's a good question, thank you. Yeah, go ahead. We are looking at the wrist bone and the shin bone, so the tibia and the radius for those who are interested in that anatomy. The main reason with those is with HR-pQCT, there are definitely limitations to how we can image bone, just because it is a pretty narrow little tube. A part of this study, though, is we are looking at DEXA parameters. So for that, we're looking at the lumbar spine, the femoral neck, and the total body. HR-pQCT just gives us a more detailed picture, which is why I'm curious to look into those parameters. Yes, go ahead.
Jada, what are the numbers at the radius?
So far, the numbers at the radius, I don't have them off the top of my head, but they're looking to be pretty in line with what we've seen in cross-sectional data with kids with type 1 diabetes before, so a little bit lower cortical density compared to kids without. But it's small differences now. But we've only had 10 kids so far, so it's hard to tell. Good question, though.
All right, let's give it a hand.